Kim, for that introduction, and I am going to jump right in, and the slides are already a little jumpy here. There we go. So before I start with the data, we wanted to take a poll of who's in the room. So if y'all could go over to the chat and let us know what sector it is that you work in, if you could introduce yourselves, let us know if you're working in local public health, physical therapy, occupational therapy, if you're a medical provider, or any of these other categories here. And if your sector isn't listed, please feel free to specify in the chat. We're happy to have you all here today. And given our tight time, I have a ton of data to run through. While y'all do that, I'm going to go ahead and jump right in and get started. And just a quick reminder for y'all to mute yourself if you haven't already. We're going to take questions in the chat during the presentation, and then at the end we can all come off mute and address any questions at that point in time too. So I mentioned I have a ton of slides. I might breeze through them pretty quickly, but feel free to, again, put those questions in the chat. So jumping right in, looking at unintentional fall-related deaths, I'll start with deaths and then move on to our hospitalization and emergency department visit data from NCPHA. Starting with deaths, unintentional fall-related deaths have continued to increase over the last 10-year period. There's been a 75% increase in these deaths, with 1,549 deaths in 2020. A good proportion of these also involve traumatic brain injury, with that also increasing by 71%, those deaths over the most recent 10-year time frame. When we look at all the leading causes of injury death, unintentional falls rank third, with 6,901 deaths over the most recent 5-year time frame. And among those, 44% also involved a traumatic brain injury. However, when we break these out by age group, unintentional falls are the #1 cause of death, for injury death specifically for adults ages 55 and older, with this population representing 95% of all the fall-related deaths in the state from 2016 to 2020. So this chart showing you the number of deaths by age group, and that dark blue portion of the columns represents the proportion of those deaths that also had a traumatic brain injury. And much like that last slide, in our 55 and older population, 43% also involved a TBI. On this slide, we're looking at the rates. So this is the number of those deaths by age group per 100,000 population. And you can see those rates are highest for our older adults, ages 75 and older, particularly those 85 and older, but rates really start to increase much earlier. You can see starting at 45 to 54, but really the 55 to 64-year-old age group. And this is partly why we're looking at that broader population throughout our presentation today. Breaking this older adult population 55 and up out by age group, you're looking at the rates by sex and race ethnicity. Males have the highest rate by sex, though there isn't much of a difference in these deaths by sex here. And then non-Hispanic whites experience the largest burden of unintentional fall death, followed by American Indians, but they have about double that rate. When we look at the subset of those deaths that also involve TBI, you can see that difference by sex is a little bit broader, with males having 22 per 100,000 rate of falls deaths. And then again, non-Hispanic whites experience the highest burden of falls deaths involving TBI. Looking at the distribution of these rates, this is those fall deaths that also include TBI by county for the adult population ages 55 and older, with the darkest counties indicating counties with the highest rates. And you can see those are concentrated in more of our western counties and central western counties in the state. And that these are crude rates, so part of that's explained with there being a little bit larger of an older adult population in these counties. When we consider costs of these fall-related deaths, in a single year, 2020 alone in the state, these deaths were estimated at costing $6 billion to the state. This comes from the CDC Whiskers estimates that consider medical or spending costs, as well as value of statistical life lost. And that's healthcare costs, lost work productivity, estimated costs for quality of life and lives lost, and that together equate to $6 billion for a single year. But those deaths really are just the tip of the iceberg. You can see for the just shy of 7,000 deaths, there were almost double the number of hospitalizations and over 1 million emergency department visits for unintentional fall. When we consider those that also included TBI, that trend is the same, with just over 3,000 deaths, 18,000 hospitalizations, and over 35,000 emergency department visits. And as excellent as these surveillance systems are to help us understand this burden, it doesn't tell us the full burden of these injuries, particularly for those involving TBI, where there are longstanding impacts on the quality of life, or for injuries that go medically unattended, or where care is sought in an outpatient setting. So we're going to shift to looking at those hospitalizations. And a lot of the slides will look pretty similar just looking at our hospitalization data. You can see trends in hospitalizations for unintentional fall have also been increasing over the most recent 5-year time frame. We're looking at 2016 onward because of the ICD-9 to 10-CM transition, which makes it difficult to compare to years prior to 2016. And you can see in 2020, we had just over 26,000 fall-related hospitalizations. The blue bar, or the blue line, excuse me, is indicating those that also had a traumatic brain injury. Those have increased a little bit, slightly, but it's been relatively stable at about 4,000 hospitalizations for unintentional falls per year. In the hospital setting, unintentional falls are the leading cause of injury hospitalization from 2016 to 2020, and this is for all ages, with a number that's about 4 times the next leading cause. MVT is motor vehicle traffic hospitalizations. A smaller proportion of these, 15%, also involve TBI, and that can speak to the severity of an injury that also involves a TBI and the more likely outcome of a death. When we look at the breakout by age, similar to deaths, the vast majority of these, 87% of these hospitalizations, were among adults ages 55 and older. This chart is actually showing you the rates by age group, so the number of deaths per 100,000, and you can see, much like the deaths, that rate is starting to jump up in the 55 to 64-year-old age group, with the highest burden being among our adults 85 and older. By demographics for sex and race ethnicity, it's a little bit different in the hospital discharge data. Females have higher rates than males. Non-Hispanic whites still have highest rates of hospitalizations for falls, and again, this is the 55 and older age group. American Indians also, however, have a high rate in this of this hospitalization for fall-related injuries that is much higher than the other 3 racial and ethnic groups on your screen. When we look at the subset of those that also involve a TBI, you can see that males have a higher rate than females. Non-Hispanic whites have a higher rate, but that rate for American Indians goes back down and is the 3rd highest rate by race ethnicity. Looking at the distribution of unintentional fall hospitalizations with traumatic brain injury for the 55 and older population, again, those counties with the highest rates are concentrated in some of our western counties, with some counties out east also experiencing some of the highest rates in the state. So shifting to our emergency department visits using our NC Detect data, you can see that the fall-related ED visits, the trends have stayed more relatively stable. There hasn't been that obvious of an increase. There was a slight increase from 2016 to 2018, and then you can see this drop from 2019 to 2020 of about 17%, and that was really due to the pandemic. We saw overall an 18% decrease in ED visits for any reason during the pandemic, indicating reduced utilization of the ED for whatever reason, all of our types of injuries in that setting. And so that really explains that drop that we're also seeing in ED visits for unintentional falls. The blue bar, again, or the blue line, excuse me, are those that also included traumatic brain injuries. And you can see a slight uptick in those numbers from 2016 to 2019, but a similar dip in 2020 related to a decrease in that utilization. In the ED setting, unintentional falls are again the leading cause of injury in the ED, followed by motor vehicle traffic related injuries, and a much smaller proportion, 3% of those also involved a TBI. Very similar to our other data sets, 53% of ED visits for unintentional falls were among the 55 and older population, and these again are rates per 100,000. You can see that there are also higher rates in the youngest age groups, infants and young children, but the rates for older adults do start to tick up again in that 55 to 64-year-old age group. By sex and race ethnicity, females have higher rates of fall-related ED visits in the 55 and older population, and non-Hispanic white populations again have the highest rates. Among those that also had TBI, rates were still highest for females and non-Hispanic whites, followed by Hispanic and then American Indian residents. Looking at the distribution by county, the highest rates again are concentrated out west in those counties, and with a few high rates out in the eastern counties, but again speaking to the higher population of older adults in some of our western counties in the state. So one thing that we do know is that experiencing a fall, regardless of whether or not it has an outcome of an injury, can increase an individual's chances of experiencing another fall. They may restrict their activity. There's a fear of falling that comes into play that can increase that risk of falling. So these data are from the North Carolina Behavioral Health factor survey, excuse me, and questioning adults 45 and older on whether or not they've experienced a fall in the last 12 months. A quarter of them reported at least one fall. 13% of adults 45 and older reported having experienced 2 or more falls. Looking at those adults that had at least one fall, 37% had a fall that resulted in an injury that reduced their activities or required medical attention. And that really does speak to that same burden of falls where they may not be in our surveillance system or in those data slides you saw earlier, given that medical attention may have been in an outpatient setting. On this slide, you can see some demographic characteristics of adults. This is 65 and older in North Carolina. I wanted to point out that 35% of older adults are known to have a disability, which can increase the risk of falling, and then highlight that call out box here that over 40% of adults 65 and older live in single person households and are living on their own. So with that in mind, if they were to experience a fall, they may have a more severe outcome, given that there may not be someone there to assist them or help them seek the medical attention that they need after experiencing a fall. Finally, I wanted to speak to the population growth that we're experiencing in North Carolina. We're expected to have all of our different age groups increase in population size, but the populations that are most at risk of falling are projected to experience the fastest growth over the next 20 years. So the blue bars here are showing a breakout of our population in 2019 by age group. The gray is the projected population distribution for 2039, and the green bar there is the percent change between those two estimates. And you can see those 85 and older are expected to jump from 2% to 3% of the population with a 117% increase. So I know I ran through those super quickly. I'm happy to take any questions in the chat or at the end. And with that, I'm going to hand it over to my colleagues, Ingrid and Jan, to tell us a little bit more about the Falls Prevention Coalition and Action Plan.
Good afternoon. My name is Jan White, and my colleague is Ingrid Busada. We have been working in, we are working both in the Division of Public Health and the Injury and Violence Prevention branch, and we're both injury prevention consultants. I have a long-standing history of working in traumatic brain injury, and Ingrid is working on the core state violence prevention program. She's the manager, and that includes both falls and TBI. So we're going to move on. Shanna, excuse me. Can we move to the next slide? Thank you. So we are looking here at how our North Carolina Falls Prevention Coalition started. And it was started by the Division of Aging and Adult Services, the Division of Public Health, and the UNC Institute on Aging, which is now defunct, starting with the dialogue in 2007, and then quickly brought in the UNC Center for Aging and Health Geriatrics Workforce Enhancement Program. That's a mouthful. Okay, excuse me. In 2014, excuse me, I keep losing my place here. Okay, there we go. In 2014, the Division of Aging and Adult Services received first an Administration for Community Living grant and established a centralized falls prevention hub called healthyagingnc.com at UNC Asheville's NC Center for Health and Wellness. They've been a key partner in the ongoing work of the coalition since then. Despite minimal funding over the years, coalition membership remains steady and has been growing in the last few years. Falls prevention activities have also increased with the state coalition, currently consisting of approximately 70 member organizations, 170 individuals, and 8 regional coalitions. Okay. So as a coalition, we do a number of things to try to bring people together. We want to build and strengthen our regional coalitions, which you will see on the next slide. We want to increase access to evidence-based practices, data, and resources. We want to educate and train our workforce, and we want to cultivate relationships and collaboration. And very importantly, we want to use policy for prevention. Okay, so next slide, please. This is a map of our regional coalitions, and you'll hear more about that later. Our state coalition meets quarterly. The next meeting is May 18th. You can click this link, and the agenda is not yet there, but the information for the meetings is on this website. Okay, move along, please. All right, this is the landing page for the coalition website. So you will see that when you first sign into the website. Next, Shanna. Okay, so there are several distinct areas. Resources, we want to be able to present North Carolina and national resources, falls data, contracts. We work a lot around Falls Prevention Awareness Week, which is always somewhere around the first day of fall. And it also has a place for the local coalitions as well as the state coalition. And we have our strategic action plans on there. Okay. This is just a little snapshot of some of the resources around data. We have fall data from Whiskers, which is from CDC. We have, we also have a North Carolina state dashboard there for falls information. So, and there's much, much more on that website. Next, please. And this is another section of our Falls Prevention Coalition website. You can see the quarterly minutes and presentation for all of the meetings. I believe we go back at least 3 years on here. And so you can go back, and if you are interested in joining, you can go back and see the type of things that we're working on. Okay, I'm going to hand this over to Ingrid.
I wanted to highlight the fact that the Falls Prevention Coalition does have an action plan. Over the last few years, our activities have really increased a lot, and we realized that we really wanted to have a chance to proactively plan for our next steps. So we released the action plan in the fall of 2020, and it covers 5 years. On the website, this is a snapshot from the website. There is an interactive feature where you can click on the goals and learn more about them, but you are also able to download the entire plan as a PDF for printing or just reading as a whole. Next slide.
Ingrid, there was a comment in the chat that it's a little hard to hear you. Would you mind speaking up a bit or moving closer to the mic? Oh, you're muted now.
Okay, I just turned up the volume. Can you hear me better?
That's much better. Thank you.
Okay, thanks. Okay, so next slide, please, Shanna. So the Falls Coalition action plan is designed to reduce the number of injuries and deaths due to falls among older adults and adults at risk for falling for various reasons like disabilities in North Carolina over the next 5 years. And the plan has 3 goals that you see here, as well as 17 objectives that fall under those goals. I mentioned that we did release this during Falls Prevention Awareness Week in 2020. And when we were putting the plan together, we had input from over 40 partners from across the state, as well as all 180 coalition members who were invited to contribute as they would like. It's also a living document, which means that we will be updating it regularly as we make progress collectively on each objective and action step. Next slide. So our first goal is to enhance opportunities for collaboration and networking among falls prevention stakeholders, and that would include sharing information and resources, building a full network of regional falls prevention coalitions, and engaging partners, as well as collaborating across the continuum of care. Next slide. Our second goal focuses on preventing falls through clinical and community integration, and we do that via resources, training, and promoting effective referral pathways. We also include using a shared risk and protective factor framework, which I will discuss further in just a moment. Next slide. So goal number 3 is focused on raising awareness and promoting statewide advocacy, and we do that through data, regional coalitions, the resources that we release. We also have a potential social media campaign, and we every year promote the Falls Prevention Awareness Week, which is the week in which the first day of fall occurs. So it varies from year to year, but the first day of fall is definitely within that 7-day period. Next slide. We currently have 4 work groups who are helping us implement the action plan, and we are always happy to welcome new folks into these work groups as well as into the larger coalition at any point. So just, always get in touch and find out more. Next slide. So as I mentioned, the action plan includes the use of a shared risk and protective factor framework. And the idea behind this concept is that this concept is, first of all, it's promoted by the CDC. And the idea behind it is that many types of health outcomes, so things like falls, as well as diseases and illnesses and other conditions, are, they often share root causes, and they often have very similar risk factors as well as protective factors. And so we decided to investigate and crosswalk the different risk and protective factors for a number of conditions and diseases and illnesses that impact older adults besides falls. And these are just a few examples of some of them. We actually investigated many more than just this, but we looked at, for example, cardiovascular disease, osteoporosis, mental health conditions, et cetera, looked at what those risk and protective factors were, and then crosswalk them with the risk and protective factors for falls. Next slide. And the reason we do that is, first of all, we want to break down the silos that divide programs, and also the prevention of many different health conditions, rather than working in silos for cardiovascular disease and falls completely separately. We know, for example, that physical activity and healthy eating can be preventive for both falls and for cardiovascular disease. And so if we shift our focus to some of those protective factors, then we are able to prevent multiple negative health outcomes simultaneously. It gives us a chance to develop new partnerships and leverage our resources and funding streams, which, as we all know, are often pretty tight. It helps us increase the efficiency of what we're doing, and to consider a larger pool of strategies. That maybe if you only think about falls prevention, that might limit the kinds of strategies that you might consider. But if you start thinking broader and really focus on those risk and protective factors, it does open up other opportunities, which helps us increase our reach as well as helps us scale up the impact of our programs and strategies. And that is all I've got. Again, if anyone is interested in joining the coalition, you are always welcome to get in touch, and we'd love to have you. I'm going to switch this over to Ellen.
Great. Thank you, Ingrid. Good afternoon, everyone. My name is Ellen Bailey. I'm the Falls Prevention Project Manager at the North Carolina Center for Health and Wellness. And I also work closely with the co-presenters today as part of the State Falls Coalition. So what I'm going to share with you are some of the prevention programs, prevention strategies, and also some resources for falls prevention that also help to prevent TBI as well. Next slide, please. So just for fun, if you feel like participating, which song from this falls prevention playlist best reflects the current state of your falls prevention work today? So this will help give us an idea of where you are in your falls prevention work. Are you walking on sunshine? You're in great form. Stand, you're holding your own. Don't stand so close to me. You're free falling, or you need some help. So if you want to participate, that would help us know how to support you as we go through the rest of the presentation. So I'll leave this here just for a second so you can see the choices. See a couple. Good. I see some. Great. So those of you who are walking on sunshine, we look forward to hearing about some of your successes, hopefully, during the presentation today, or you can always join the coalition and let us know those as well. So I'm going to go ahead in the interest of time, go to the next slide, but please keep those coming. So as Jan mentioned earlier, as part of one of the original falls prevention grants with the state, a statewide resource center was established, a falls prevention hub, but we also support all types of evidence-based health promotion programs. So you can explore these different programs at healthyagingnorthcarolina.com. We are a resource center in terms of promoting the different types of programs, as well as we share lots of resources and training opportunities for statewide partners as well. And I'll circle back to this towards the end of my section. So just to share, make sure we have some shared common language. The evidence-based programs that we support are proven by research to promote health and prevent disease among older adults. They're based on this research that has been demonstrated in a community setting, which is really important, and have documented health benefits. And they also allow for some more efficient use of available resources, because many of these programs use trained lay leaders or coaches to help lead the programs. The programs on our website are specifically designed for particular health issues. So that's the research, they've been researched for these health issues. Many of them support participants in choosing their own goals for their participation in the program. And I think even more importantly now, during COVID, but it's always important, there's a lot of peer support and social interaction in these community-based programs for older adults. Next slide, please. Thank you. So the evidence-based programs that we support here at Healthy Aging, and that's determined by our grant funding, are 2 falls prevention programs, particularly A Matter of Balance and Tai Chi for Arthritis and Fall Prevention. We also support the Chronic Disease Self-Education Program suite of programs for chronic disease, chronic pain, and diabetes self-management, as well as Walk with Ease, which is an Arthritis Foundation approved program to promote physical activity and walking. There are other programs across the state that are equally valuable. And so I really encourage you to connect with your local senior centers, your community centers, your area agencies on aging, and find out what's happening in your county and your community. And we're happy to help to make those connections as well. Yeah, and so these are the ones that I mentioned for Healthy Aging, but you'll see some of the others that are supported, for example, by YMCA's Moving for Better Balance and Enhanced Fitness, as well as a few others. The categories here are based on the research and how these programs are submitted for approval. So that's why you'll see them in different categories. But we really, as Ingrid said, promote a continuum of programming so that someone, for example, who may have had a TBI and could possibly have, that is a chronic condition. So we promote thinking about the whole person and looking at the different types of programs that could be supportive, for example, chronic pain and a falls prevention program at the same time. So I'm just going to highlight 2 of the programs. You have an idea of who they're designed for and who can benefit. So A Matter of Balance is the most popular program in North Carolina across the state. And it's really ideal for what Shanna mentioned earlier, those older adults who might have a fear of falling or have had a previous fall and are maybe starting to limit their activities and therefore losing some strength and engagement. This is really ideal for them. So people in this program work together to brainstorm some solutions, build some skills around problem solving with their fear of falling, and engage in gentle exercises. So it's led by trained coaches. The group size is small for safety and discussion, and it meets for 8 2-hour sessions. There's also a virtual option now, which came about during the pandemic. So we're hoping that that can help reach more people as well. So many people in North Carolina who have gone through this program have reported that they are more comfortable increasing their activity and talking about their fear of falling and plan to continue exercising. So these are just some of the outcomes we've seen with A Matter of Balance. I also wanted to mention for A Matter of Balance, it's ideal for people who are maybe at a moderate to higher risk. It's okay, Shanna, we're good. You can stay on the Tai Chi. Thank you though. A Matter of Balance is really for those people who are at a higher risk of falling. And if they can complete A Matter of Balance and want to keep going with their new increased activity, Tai Chi for arthritis and fall prevention or another type of Tai Chi would be ideal. So this particular program is for participants who are at a lower moderate risk of falling. We would not want someone who's at a high risk of falling in this program, but it's designed with a higher stance, a type of Tai Chi that is safe for older adults. And it's also led by trained instructors, going to have a slightly larger class size, and it meets for 20 1-hour sessions in order to meet the research, the benefit designed in the research. So it helps to improve mobility, balance, strength, flexibility, and relaxation, and just generally improves proprioception. So people have a better awareness of where their body is in space. And these are some of the benefits that have been found in the research, some of the improvements in balance, strength, mobility, flexibility, and also preventing falls. So you'll have this for access after the presentation, or I can send it to you via Healthy Aging. But if you or anyone in your organization is interested in becoming a trained leader, especially in public health departments, PTs, clinical settings, these programs can really be offered in the clinical or community settings. There's a one-pager that describes how to become trained if you want to share that within your organizations or learn more. And as we circle back to healthy aging, I just want to highlight some of the resources since we're talking about prevention and how to prevent falls and TBI. We have a lot of the resources on Healthy Aging North Carolina, as well as the Falls Prevention Coalition. So I'm just going to highlight a few of those today before we move on to Scott. So on our website, you can find current programs, current evidence-based programs that are happening in your communities. And these are the ones normally that are posted by our partners. We work closely with the area agencies on aging in North Carolina, which cover the 16, there are 16 agencies that cover our 100 counties. Next slide, please. And I also wanted to add, if you don't find a program in your area, please use this referral form because it helps us to communicate to a certain area like, wow, there are about 10 people who really want to take a program in your area, and we can work with them to build capacity for this program. So this referral form on our website is connected with NCPHA 360. Anyone can make a referral, a family member can make a referral, a provider can make a referral. It's a HIPAA compliant form, and this helps us get it to connect to the agency offering programs at the local level. So this is one example of a resource that we share on both websites. I'm going to highlight it for a couple of reasons. It's very accessible. It comes from the National Council on Aging, and it highlights kind of 6 main areas, 6 steps to prevent a fall. So for example, finding a good balance and exercise program like Tai Chi or Matter of Balance, improving communication with healthcare providers and family members, talking about that fear of falling. Next slide, please. Some other areas we really work to highlight in the coalition as well are polypharmacy, reviewing medications with doctors and pharmacists, getting vision and hearing checked, as Ingrid mentioned, like looking at those protective, shared risk and protective factors. Home safety, there are several home safety checklists that you can find on both websites to download and share with your community members or patients, whoever you might be working with. And I wanted to tie this in. You can go to the next slide. Yeah, thank you. Tie this in with our regional coalitions that Jan mentioned earlier. So there are 8 active regional coalitions in North Carolina, and you'll see them highlighted in color here. If you are in one of these counties that doesn't currently have a color, then please reach out to me because we're really working through our action plan to connect all 100 counties in the next 4 years to a regional coalition. But at the local level is really where you can find out what exactly is happening in your community and find those local experts, for example, who's working on medication, who's offering programs, who's doing home modifications, for example. So I encourage you to connect with the state coalition as well as your regional coalition. And here's an example. Each coalition has a link on our page to either their current resources in their specific counties, upcoming meetings. For example, in Western North Carolina, they have their schedule there. So every coalition operates independently and to their capacity because almost all are volunteer, but you can kind of peruse that at your own time. And some example of resources on those 6 steps, those 6 areas that I highlighted earlier. We really love the CDC study initiative. So you can share some of these if they're helpful to you. A medication fact sheet to help people understand if they're taking more than 4 or 5 of certain types of medicines that could increase their risk for falls. And a caregiver could go over that or take it to their pharmacist. a check for safety, a home safety brochure. And I wanted to highlight here the Stay Independent brochure is also the same as the Falls Free Checkup, which is right underneath of it. And that's a self-assessment. I know one doctor who used to give this to patients before they came to their visit and then would review it with them. The Falls Free Checkup is online and provides people with feedback with an email highlighting risk factors that can be taken to a healthcare provider for discussion. So there's also plenty of resources on our websites for healthcare providers as well. Wanted to highlight where these arrows are, links on the Falls Coalition website for home modifications. And this is a North Carolina specific page where you can go and see who can offer and who can help with home modifications in your area of the state if you're working with an older adult who really needs that. And some next steps, these are all active links here in the green, but just encourage you as a follow-up to, explore some of the program details, share this referral option in your public health community. I saw that some of you have PT, someone working in health education, connect community leaders to these trainings. If you can identify people in health departments or Parks and Rec, whoever you may be working with to get trained, that helps improve the offerings in different communities and just to explore the falls prevention resources available. So I'm going to pass it on to Scott, I think here. Yeah, so you'll have a link here for summary and my email if you have any questions afterwards. So I'm going to pass it over to Scott. So thank you. I'll be happy to take any questions in the chat as we go along.
Hello, good afternoon, everybody. My name is Scott Pokorny, and I'm the TBI team lead at the Division of Mental Health, Developmental Disabilities, and Substance Abuse Services. My primary role is managing all of the TBI programming for the state, with the exception of the TBI waiver, which I co-manage with our sister Division of Health Benefits. Next slide, please. So we were wanting to get an idea of your experience or general education in regards to traumatic brain injury. So if you could put in the chat your answer to the following question: what is your level of expertise working with the TBI population? And you can see the different categories there, from no understanding of TBI at all to an advanced, highly developed skill and ability, including the continuing education and practical hands-on work experience in the category of 10 plus years. So in the interest of time, I am going to move forward, but if you could please, if you would, answer that question, so that gives us an opportunity to learn more about your skill set with the traumatic brain injury population and things that we might be able to offer you in the future to help increase your knowledge, skills, and abilities with this population. So the TBI program has several components. And those include, as you can see here, our TBI grant, our state-funded program. We offer TBI training, screening. Of course, as I mentioned, our TBI waiver program, which I will explain a little bit more later, our Brain Injury Advisory Council, and then certainly all of the resources that we have and are happy to help facilitate connections to those throughout the state. Next slide, please. So if an individual has a TBI and are looking for long-term or even short-term supports, it is important to definitely be familiar with your local management entity, managed care organization system. So each, there are 6 regions currently in the state, and each region serves the counties that are under that region with behavioral health services, of which TBI falls. So again, there are 6 LME MCOs in the state, and we are anticipating those to transition into tailored plans on December 1st of 2022. You can identify what LME MCO corresponds with your county at the website link provided on the screen. So those LME MCOs in general offer not only TBI services, but certainly substance use disorder, mental health services, and intellectual and developmental disability services. So it's important to recognize that TBI certainly blends across other programs. So we do find folks with traumatic brain injury in the IDD system, for example, Certainly individuals with traumatic brain injury may have mental health challenges, substance use challenges. So it's really a mix. Although there are specific TBI services, they are also found, individuals with TBI are also found throughout the other programs offered by the LME MCOs. Next slide, please. So this is just to give you an idea of where to go and who to contact for different services that you or individuals that you may be working with might need. This is for the continuum of ages, so this might not be applicable to the populations that you serve, but we just like to kind of give this out for reference so that you have that in the future. So certainly for all of the services, you must have an established residency in North Carolina. You must, for those seeking, in North Carolina, TBI is actually defined as an intellectual and developmental disability for one set of services, and then also defined in its own right as a distinct disability in and of itself for a different set of services. And those are differentiated by age groups. So probably for this group that that I'm speaking with today, you would probably be more focused on those services and supports that would serve individuals 22 years old and older. And so that would be more of your community alternatives program for disabled adults, for example, which you can access through the Division of Health Benefits and your county social services offices. You would obviously be wanting to pursue Social Security, as well as any type of potential state operated health facilities, services that may be available for folks. Certainly helping folks get on Medicaid if that's a viable option for them, if they meet those qualifications. Some folks have dual eligibility, so we see folks that have Medicaid and Medicare, both of those coverages covering different parts of services that are provided. Next slide, please. So again, additional resources and just kind of focusing on the adult population here. So you would certainly, as I mentioned a minute ago, potentially pursue the Community Alternatives Program for disabled adults. For those individuals that may be eligible for Medicaid, home health services, personal care services, private duty nursing, all of those things that you would be able to access through the local management entity managed care organization, soon to be called tailored plans, again, as a reminder, starting December 1st. Other general additional resources for you to consider are First in Families of North Carolina that do provide certain supports to individuals with traumatic brain injury, whether they may need a home modification or some durable medical equipment or other types of assistance that they are not able to access through other programs. Certainly the Brain Injury Association of North Carolina is the primary resource for a lot of folks that are looking for information and resources in regards to brain injury, whether that's information, training opportunities, educational initiatives, being linked to resources in your local community and so forth. They do have 5 offices throughout the state. So you can contact them and they can link you up with your local Brain Injury Association office. There's also certainly Disability Rights North Carolina. That is a great resource for people that might be experiencing problems getting into programs for which they're eligible. And then certainly within our division, we have community empowerment and engagement. So a lot of consumer rights programming and things of that nature that might be helpful for individuals that are looking to get assistance with accessing programs or who are looking to get involved in the Consumer and Family Advisory Council or other types of stakeholder or activist types of activities that are offered through our division. Next slide, please. So just to kind of hit on our TBI grant briefly. So we were recently awarded this past August 1st, a grant through the Administration for Community Living. And our main grant goal is to continue to facilitate the development and expansion of a comprehensive, easily accessible system of care for individuals with traumatic brain injury and their families. So essentially, we're really working with all of the service systems in the state to not only strengthen, but and add on to the services and supports that exist. So for example, we are working with our sister division on our substance use disorder Medicaid waiver that will have a TBI residential component to it so that we can offer rehabilitation to those individuals that might need that. And so we are working with the LME MCO system through some of our grant funds in order to develop capacity, provider capacity to be able to provide those services in a knowledgeable and supportive manner for the individuals that we serve. So some of the grant objectives too are to provide screening. So we are looking to screen. Currently, we are screening at 5 of the 6 LME MCOs. We are looking to not only expand that to include all 6 LME MCOs, but also their provider networks. And so we have implemented a national standardized screening tool and are able to sort of track how many individuals that are trying to access services and supports through the LME MCO system may have sustained a brain injury. Again, increasing provider knowledge, skill, and ability across all of the service programs. Obviously, with COVID, a lot of the support groups ended up transitioning to a virtual environment. And so that has actually really led to a significant increase in people's attendance at those types of groups. And so we are looking to expand and add additional support group opportunities throughout the state in an online format. And then, of course, always making sure that we are providing services in a person-centered way to ensure that people are feeling empowered and that their unique needs are being met. Next slide, please.
Where did this come from?
So the TBI state funds program, we have about $4 million now. We just got a $1.6 million increase in the last session. And so we do have contracts with the Brain Injury Association of North Carolina to provide education and awareness throughout the state, annual conference and so forth. We are also contract or allocate funds to the 6 LME MCOs to provide various services and supports, such as residential, home mods, transportation, personal care, respite, and so forth. The nice thing about the TBI state funds program is you do not need to be Medicaid eligible. So for those people that are just on the line, or for those people that might be coming right out of rehab, they can certainly access this program, and financial eligibility is not a consideration. So that makes it nice to help them transition back home or transition into services that they may need in the community. Next slide, please. So again, training, we hit on this briefly. We offer a variety of trainings. A lot of these trainings are developed through our TBI grant through Administration for Community Living, and then also through our state-funded contracts that we have with the Brain Injury Association. So we have trainings on behavioral challenges, concussion prevention and awareness, working with law enforcement, primary care and TBI. So helping primary care providers understand traumatic brain injury better and being able to identify those on their caseload that they might have with traumatic brain injury, employment and brain injury, and just a variety of other training topics. And these are offered in person in webinar and then on self-paced online training modules. And a lot of those, most of those can be accessed at the Bianca website noted on the page. Next slide, please. So again, screening our data initiatives, of course, screening at 5 of the 6 LME MCOs, which I have mentioned. We are about to initiate acquired brain injury screening, which includes both traumatic and non-traumatic brain injuries at a domestic violence program pilot site in Davidson County, as well as a probation pilot site that has yet to be determined. And so that is our first inroad initiative into identifying folks with brain injury in these types of settings. And we're hoping to that they will be a success and we will be able to expand those beyond those pilot programs. We also do claims data reviews so that we can get a better understanding of how many individuals with traumatic brain injury are accessing various services, whether those are state funded mental health block grant or substance use block grant funded, Medicaid funded, and so forth. And so we continue to look at those paid claims data to get a better picture of where folks with traumatic brain injury are accessing the service system. Next slide, please. So I mentioned earlier, in collaboration with the Division of Health Benefits, the North Carolina TBI waiver, that's currently in 4 counties, Wake, Durham, Johnston, and Cumberland. We are going to be expanding that into Orange and Mecklenburg counties in the spring. You must have had your brain injury after the age of 22, must be Medicaid eligible. We do offer 2 different levels of care for that program, skilled nursing and neurobehavioral. Next slide, please. And obviously there are both medical and financial eligibility requirements for that program as part of the entrance requirements. So some of the, as you can see here, there is a list of some of the services that are available. The main ones that are most popular for the brain injury community that we've tracked so far are, of course, the cognitive rehabilitation, the life skills training, and the extended state plan allied health services. Certainly all of the services are accessed, but those are certainly among the more popular TBI specific services that you wouldn't find in any of the other programming in North Carolina. And just to kind of finish off with this, we are looking to expand that TBI waiver statewide within the next 5 years. Next slide, please. Okay, so we also provide administrative support at our division for the Brain Injury Advisory Council. And the purpose of the council is to review the nature and cause of traumatic and other acquired brain injuries. We are in the process of updating the purpose and the goals and objectives of the council. There are 33 council members. They are appointed by various governmental departments, and their primary objective is to make recommendations to the governor, the General Assembly, and the Secretary of Health and Human Services regarding all things brain injury in the state. So certainly the continuum of care, the service delivery system, inclusion of TBI in all aspects of service and supports that are available. The council does meet quarterly. There are several standing committees with the council that actively engage and then provide specific information on focused initiatives to the greater council to consider pursuing as a goal overall. Next slide, please. So here are just some brain injury resources. Some are state specific and some are more national that I would encourage you all to look into for additional information and background information for individuals that you might work with. So of course, the Brain Injury Association, our department TBI program web page, and then of course these more national resources as well. And I think that concludes my presentation for today. Thank you.
Thank you, Scott, and everyone who attended our webinar today. That was very informative. I know I learned a lot today. And I just want to remind everybody that the slides and the recording of this webinar will be shared with you next week once it gets all done and everything. And then we have make sure to save the date for our next lunch and learn, which will be on May 26th on sexual violence. And you can check our website how to sign up for that soon. So enjoy the rest of your day. And thank you again for attending, everybody, and to all our presenters. Oh, did we have any Q&A? Anybody have any questions?
Thank you, Shanna, for advancing all the slides. And thank you for inviting us.
Yeah, thank you for having us.
Thank you, Kim.
Everyone.